Healthcare spending reached $3 trillion, an average of $9,523 per person. Yet we are the only developed country that does not guarantee access to basic health care for all of our population. Our working middle-class families are forced to choose between health insurance and other basic family needs. And Coloradans with insurance continue to experience medical bankruptcy even after the Affordable Care Act. I personally think this is unacceptable and that it's shameful. A 2012 Kaiser Family Fund donors, Pharma, DaVita, the Lockton Company, and many other people who feed at the healthcare industry team are investing hundreds of thousands of dollars to defeat Colorado Amendment 69 because they know that they profit from our distress. And they are very smart at playing games to maximize their profit.
That board, those boards will be, as I said, publicly elected. And when you look at what local elections have come to in Colorado, I know many of you like me are policy wonks, policy geeks. You've spent a lot of time looking at and thinking about Tabor, Gallagher, Amendment 23, the interplay of those initiatives. Regardless of what you think of the substance of those policies, has created challenges for our government in terms of how we budget and how we administer our programs. And so blocking another large and complex issue to negotiate such an amendment or such a waiver, and what would happen during that time. What's interesting is that the proponents have envisioned a transition period. Clinicians, our researchers, those who are developing cutting-edge therapies, our institutions of excellence or centers of excellence, whether that's Children's Hospital of Colorado or National Jewish or Craig Hospital, how will they continue to make, they can offer those physicians and other healthcare providers and researchers more resources. So I actually am concerned that
quality and thinking around this. As I said earlier, I share the goal of reaching universal health care. I think the senator makes very compelling points about the need to solve access to coverage for people who are here in this country working in an undocumented status. But it's not the job of the No campaign to provide the path forward. I frankly think that those of you who are sitting in this room and have been working on these issues for the last 10 or 12 years know the challenges associated with these policy issues and are well positioned to help us move forward an access to care solution that will meet the needs of all Coloradans.
Several questions are about family planning services and using taxpayer money to provide abortion services. Senator Aguilar, can you comment on how Colorado Care would reconcile that?
I should have been. This is a deep concern. It is a loss of benefit for women who have private coverage today through their insurance plan for abortion services, regardless of circumstance.
And the other thing is that our rural hospitals are the ones who really need, along with Denver Health, and I'm on their board, but we really need the hospital provider fee because they don't get the kind of income the Front Range gets. And so one of the duties of Colorado Care is to devise payment mechanisms necessary to ensure that there's an adequate supply of providers in the rural communities. And secondly, what I would envision, some of you are probably thinking, oh God, we go from 150 hospitals to 70, but we have enough hospitals, is that one of the duties of Colorado will be to ensure that they backfill and actually pay for certain hospitals to be open based on need, not on profit.
So I just want to note that this is how the Senate that we have in Colorado.
I just want to say that having sat at the political table for 6 years now, I say we junk it, we just take it over as a people's revolution, and I'm pleased to lead that.
I'm going to ask my final question. Cody and the Senator will be around for a few minutes afterwards if we didn't get to your question today.
That's interesting. I think for a lot of people, myself included, healthcare is a head and a heart issue, right? I'm the mom of 2 young kids. I'm parenting an aging father who just this week had to go through surgery in a different state. And I think that at the end of the day, The people that we love, we want to be healthy. We want them to thrive. We want them to be successful. And I think there is certainly real frustration in America about the limitations of our healthcare system. And as I've said before, and I'll say again, I think those frustrations are valid and they're real. But we have a system that is providing health insurance to 94% of Coloradans. We have a healthcare system that provides high-quality, good-paying jobs to a significant portion of our workforce. We have a healthcare system that is not perfect. And what we are being asked to do is to scrap a system that, again, is not perfect, but is meeting the needs of most Coloradans in favor of something that is entirely untested and, frankly, very, very expensive. And we could very well end up in a situation where we're paying more for less. And that's an outcome that I think would hurt us both in our heart and in our head. After this political primary season, I've given up on prognosticating. So I'm going to say that I don't make predictions, but that I promise that the No on Amendment 69 campaign will be here.